I think a lot of people say, oh, the system, but we are the system. We are part of the system. How we're leading every day, how we're treating our staff, how we're treating the front desk, how we're treating patients, how we're treating our colleagues, how we talk to each other. That is where the change starts, and then it trickles down. So we're all part of the system. And so I think we've got to really infuse that with love a lot more.
Hello, everyone, and I'm delighted to welcome you to this week's episode of Roots of Healing. I'm Dr. Siri Chand Khalsa, and I have the most beautiful guest with me, who I'm a longtime fan of, Dr. Diana Londoño, and she is coming to us from Southern California in Los Angeles, and I'm just delighted to welcome you to the podcast today.
Well, first of all, thank you for, all that you are, not just what you do, but just your being and your energy and your radiance and your authenticity. I'm definitely a big fan as well. And I'm just so delighted that you started this. I just jumped on the opportunity to be here because I think these conversations are so important. And I think more of us, especially as physicians, talking about all these topics is really, really needed. There's a void, there's a need, and they're happening, but I think it has to happen in a bigger way. And I think people are going to also join to understand this is really important.
It is so important. And, both of us are probably what I like to call mid to late career, as we like to say, meaning we've been in medicine a while. And recently I've just been noticing more presence in social media of young clinicians who are talking about the medical school journey, the residency journey, and their voices have become really amplified. And I feel like we're over here like dealing with burnout, like what happens from the 30 years of this, intensity of the training to this arc of a career? And how do we maintain our own integrity, our own value system, and our own evolution as a healer? And in light of that, I'd love to hear just a little bit more about the early years of your career, what woke you up to yourself as a healer, and about your particular profession and niche in medicine. I'd love to just tell us a little bit about that.
Yeah, well, first of all, I love that you say healer because I think it's so important. And I think, we sort of forget the true meaning of physician, which is a teacher and a healer. And we forget that. And, through training, we're just, in ways overwhelmed with so much information that we're just trying to understand what is a disease, how do we diagnose it, first of all, and then what is it to treat it. And we're trying to learn treatments. And obviously, in Western medicine, is very much this is the medication that's going to treat it, and this is the surgery that maybe is going to heal some, anatomical obstruction or things like that. But we sort of lose all the other parts of it that are so critical. And especially, for me going to UCLA, which is a great medical school, but I was not taught anything about trauma, anything about stress, anything about truly, yes, this mind body connection. It just was sort of separate, even though we were supposed to do a system based education with all the systems being together. We still sort of missed that boat and that point. And it really wasn't until, burnout that, going through burnout and I'm understanding now I have all these physical manifestations of diseases and problems and pains and things physically. What is causing it? How do I get out of it? And so it was really myself learning, reading, just going, diving deep into books and trying to understand what is happening to my body that I was not taught in med school. And how do I get out of this? And just really then understanding, what we can do to be preventative, not only in our own burnout and in our own wellness, but then also that actually translates to patient care because we don't focus on prevention, we don't focus on health maintenance. We're just disease sort of maintenance, and then kind of come back every 3 months to maintain your disease. But what about if we go back a little bit and start doing prevention and just staying well? What can we do? And then again, we really are not taught that, like whether it's trauma, stress, nutrition. So I just love, all the things you do because that's a huge component of nutrition is, our food is our disease or it's our wellness. So when we don't know that as physicians, we can't teach that. We can't do that for our own patients. So I had part of it I knew, but part of it I had to learn. through burnout to then be able to really incorporate that a lot more and focus on that for patients too.
Yeah, it's so interesting because I don't know if you remember back when we were residents, somebody said to me, "You'll be an experienced attending." So I'm an internist and I did my training at Mayo Clinic, which was like UCLA, really formal place. And someone along the way in that training pathway said, "When you're done, it'll be about 5 years in and you'll be comfortable." Do you remember anyone ever saying to you that magic 5 year number? Like 5 years out of a residency, you'll cross over to this zone where you'll things will feel familiar. You'll be like, I've seen this 2, 3, 4, 10 times. But what they don't say is what happens at year 15, year 20, when there's this interesting passage, as you're alluding to here so profoundly, where you go from all that I knew, now I need to unlearn a little bit of that because that system isn't sustaining my health, think that way and stylized way of thinking. And I need to do healing because my body, my mind, my spirit, sometimes all three, are going through this fluctuating period. And it's so common, especially for intuitive, empathic women in medicine. I feel like, particularly in our age range where certain concepts and theories were much less likely to have been discussed. I think things are emerging differently now, and partly because our voices are so much more prominent. I didn't have a mentor who said, or a coach who said, hey, here's how you can make a career transition. Here's how you can incorporate something that maybe not everyone agrees with, but brings value to the clients and patients that you work with. So I love how you brought that in. Tell us a little bit about your early training, your background. You grew up in Mexico City, and then tell us what your training trajectory was.
Yeah, I grew up in Mexico City. I was born there. I lived till I was 12, and then I moved to the States when my parents separated, and came and I did basically all my schooling in Southern California. So I did all my medical school residency in urology for 6 years, and then went off actually to Florida for 4 years, and then came back. And I've done kind of this slew of prior practice, employed, academic. I mean, I've done different ones, and you know again, we're so trained in one way mindset that I think is so important to realize as physicians, especially with I mean, the last 10 years, especially, it's so different what it was and what it is, what medicine has become. And it's very different. It's not even how I train, not just the concepts. I'm saying what medicine looks like, what delivering care means, what, you know, uh, all these other factors. So, you know, sometimes because we're so one minded, we forget that we have so many skills. And yes, what we learn is very good, is going to help us, but we can step out and use our knowledge and our skills to help people in many, many ways that maybe haven't been done. Maybe they have been done. Maybe it's a mixture, but it's so important to really, be true to ourselves, what feels right, and just be ourselves. I think when we talk about training and so as we go through training, especially with surgery, we can kind of get lost and not be ourselves because of we're told to act a certain way or be a certain way, or you take too long with patients, all these comments that are said. And that's actually not a bad thing. If somebody says that, I'm like, that's right. I do take a long time because that's important for me, or that's what is valuable for me. And we tend to internalize and think like there's something wrong with us when those comments are said. And actually, that's a compliment. Thank you very much for saying that. That's what I want to do. It's important to stay true to ourselves and to our values, to our beliefs, to what feels right. Because when we stop doing that or stop being that, then that creates that split where something's not right. I'm not being myself. And that really leads to anxiety and depression and all these other things and burnout because we're chronically stressed being something that is not feeling right. And I think as you talk about empaths or sensitive people or just people that don't really fit this box, it's like it starts wearing on us when we are in a place where it's a box and we're not boxes. We are multidimensional. We have other interests. We have other things that light us up that maybe when you look around, people around you are not interested in that, but that's okay. You just have to stay true to you.
That's so beautifully said. Thank you. Bravo. So I'm curious. I'm always curious a little bit on what I like to call origin stories. And I'm curious if there was a time when you were very young or before all your medical training where you had a connection to an ancient, more organic part of oneself that had that healer's knowledge or intuition, or there was a mentor. What was the spark for you? Was it at a young age? Was it in your career? Where did you first notice that maybe you understood things in a way that wasn't how everyone else around you was explaining it?
Yeah, that's interesting. I don't think from the going to the medical path was something early, but I think I've always been very vocal. Like, I don't feel like I fit in with all the surroundings, even when I'm in my family. I don't feel like I'm really part of it, even though it's my blood family. And so I already felt very different, and I was okay being different and being just whatever was my personality, my calling, or what I wanted to do. And I was very vocal of like, this is what I want. I'm not shy to say this is what I need. And if I'm going to do something you don't like it or it's criticized, I'm okay with it, even if it's my own family. So I sort of built that sort of skin that I don't worry too much about what other people say, which is helpful. But in terms of like what was a path for medicine early on, not much. I mean, I think it's great to be raised in a society in Mexico. There's a lot of mysticism. There's a lot of different alternative therapies. So yes, people believe in everything, but they believe in a lot of different things, and it's not looked at so oddly as it is in some other parts of the world. So to me, think of some alternative treatment. It's just part of what people do. It is not really called out alternative. It just is. People go here, people go there, people get surgery. It's just all encompassing. So I always sort of had that in the background. Now, when I went into medicine, was really when my dad, they were separated, and I did come back in one of the trips to see him, and I saw him very different state from very strong and very good looking. He has his blue eyes and tan. All the skin is very different from Mexico. And coming and see him very weak and feeble in a wheelchair and paralyzed, and I'm like, what's going on? So seeing that change and not even understanding what was happening because it's not talked about, these diseases and things like that, but understanding that how I was others and himself wanted to be taken care of, and how his dignity was so important, during illness, and how sometimes, when you're in a medical place, like sort of the dignity of who you are and what's important to you, how you're dressed, that gets taken away very quickly when you're in an ugly gown and all your belongings are taken away. So you sort of lose yourself and you're sort of very vulnerable in this
Mm,
state. And so I sort of understood like even in disease, it's so important to maintain that. And that just kind of had a little seed, planted there. And then I decided to pursue medicine, but really always understanding that is really important to maintain dignity, in illness,
mm,
especially in urology. There's so many things that can be very shameful, or people are embarrassed about, or it's about the genitals and examining them. And how do you maintain dignity in an exam that's very vulnerable? So
mm,
it's so important to maintain that, and it can be little things. I mean, but they're not so little. Like when you finish an exam, for example, in a male, if I do a digital rectal exam, I examine them. I say, here's your tissue so you can clean up the jelly. I don't want you to go home with jelly. That's awful. Nobody tells them that. I'm going to sit
yeah.
outside while you get dressed and comfortable, and I'll be back and talk to you. I mean, there's something
Mm,
very demeaning about cleaning your butt with jelly in front of somebody, whether it's a man or a woman physician. So you have to give people space and dignity of something that's
mm,
already very, you feel like it's not very, humanizing there. So
yeah.
little things, I think we can go a long way in doing things to maintain dignity, to take care of the whole person, and not diminish that for them.
Yeah, that's so beautifully said. You think about it's so often you think about what is the routine, what is the normal, what is it that everyone does, and what happens when you say, wow, my experience has led me to have a slightly different perspective here. And it's so beautiful how you've woven in and integrated the journey you had with your dad so longitudinally. And I think that this is something that tangentially we hadn't thought about talking about, but this understanding that our life is the medicine in a way, especially as a clinician, and that there's this bridging quality of being both patient and clinician sometimes, and recognizing the humility of the patient journey and saying, listen, I want you to have dignity. I am here as a teacher, as a coach, as a mentor, as a surgeon in some cases where you deem it necessary that a surgical intervention is needed. And to give people that sense of dignity and empowerment and seeing them. Sometimes those exams, people come and go and they don't even actually feel seen. So to bring that humanity into the exam and say, I'll be right here. I'm taking extra moment and recognizing, like, I'm sure we'll have listeners that reach out and say, I've definitely been in an exam where I didn't feel dignified afterwards. And what a powerful thing to bring into awareness in your field, which is, I believe, 10% women and 0.5% that have a Latin American background. So I think that that's pretty phenomenal that you're bridging all your sort of streams of awareness into your practice. What a gift for your patient.
Well, I think we can all do, I mean, in anything we do. I mean, like you said, we are so automatic. Like, this is what we got to do. This is steps. We just got to get the diagnosis, get the patient through. And it's just so rushed that we just have to hurry. But there's little micro pauses that make such a difference that people can feel like not so scared. And I mean, even if it's an IV placement, I mean, well, if hopefully if you're a patient, you will understand, it's so hard to be a patient to understand the other side of how you want to be treated. But I hope even if you're never a patient, you give that to your patient. And again, we can do the same equation with a female pelvic exam. I mean, how many of, let's say, my colleagues examine them while they're still naked and talk to them throughout the whole thing, when they can just say, okay, go get dressed. I'll be back. Let's regroup once you're dressed. So it's just like they kind of seem little, but they're not because nobody wants to have a whole conversation with a physician when you're half naked. Let's just let people get dressed and come back and regroup and then have the whole conversation when you feel a little bit like safer and more comfortable in your own skin than, half draped, everything showing, and they're trying to explain something about a surgery. That's not the right time to talk to people. So again, stepping back a little bit, it doesn't take that much really truly extra time to give the people space and a little bit of time to regroup as well.
That's so beautiful. I'm curious, just bringing together, and we're going to explore a little bit of where your journey took you after all your residency and such, because I know you've had extensive additional explorations. I sense you're a lifelong learner. I'm curious, in your practice as a urologist, how, outside of just your healing presence and the intentionality, have you brought in any integrative or consciousness oriented practices to your clients? Probably doesn't apply for everyone, but when it does, can you share a little bit about what a visit with you might look like that maybe your colleagues could be more curious about?
Yeah, so a lot of my patients will cry, and it's not because it's cancer, and it's not because it's bad news, but it's because I ask those questions and I get curious, and I really ask to tell me more. When they just tell me something, I say, "Oh, that's interesting. Tell me," and then like the floodgates open and they tell me something that was really on their mind that is causing them grief, anxiety, stress. And I ask about these things because these things are important in their health or their disease. As a urologist, if you have frequent urination, being frequently, going urgently, of course, there's many medical reasons for that. But if you don't address the stress, the fact that, something's happening with their bank account or somebody like died at home or, they're being a caretaker and that's an additional stress or whatever's happening in their life, if I don't address or ask about that, their symptoms may not get better per se, even with medication. Like, yes, we can help them, but it's not going to get to the root of it because the root usually, because our mind is connected to our body, our bladder, our intestines, it's going to be going overactive because that's what your nervous system is doing. It's like on chronic, like, all the stress hormones being flooding your system. So when I ask about that, yes, tears happen, but that's okay. They've got to like release that. They got to let that go. They've got to unload it on somebody because they've been holding on to this and nobody's asked them, and especially a physician. So it is important to address the stressors, the trauma, the grief, and sometimes patients just tell me about their father-in-law that died, and that's their whole appointment. And then at the end, we'll say, "Okay, here's your Flomax." But what they needed was somebody that is gonna listen to them, and
Mm,
that's where the healing truly, truly is, to be listened to. So, I really do try to get curious. I mean, I really ask a lot of questions. I address stress, trauma, and all these things, because that helps them with overactive bladder, pelvic pain, pelvic floor dysfunction. All the muscles get very tight. So I really bring that in. Of course I do physical therapy, I do muscle relaxants, all that, but I also have them do simple things that, are mindfulness practices, or how to get rid of stress energy. And that's things I learned from, energy healing, which is pranic healing. And it's getting into a salt bath, and getting to the bathtub and just adding salt. Table salt really is all that it needs. And you could add tea tree or lavender oil is very, very helpful to pull out that stress energy. And when you do that, a couple of times a week, your stress levels are going to be much less. You just release all the stress energy. And people think, "Oh, it's a little wee wee woo woo," but it's not, because if you look at surfers, well, they're in salt baths all day. It's a salt water. You go yourself if you're close to the ocean, but if you don't have that luxury, you could do it at home for like $3. Get a salt pound of it and put it in the tub, and that's gonna help. So we're gonna talk about those things. We're gonna talk about movement. Like, what are you doing for movement? Because maybe you're also constipated, and that is causing a lot of problems in urology, because it goes together: constipation and infections and pain and all those things. So we're going to talk about movement. What are you doing for that, or not doing for that? What's your water intake? Like, what are we eating? Because that's going to affect all these things. So we talk about all that. We talk about who is your support network. I mean, all these things we try to weave them in. And I do also a lot of prevention for kidney stones, and that's a lot like diet related. We have to talk about lowering your salt, and like processed foods, cutting those out because it's all full of salt, or all this sugar. So we talk a lot about food and nutrition, and what to do, not only for kidney stone prevention, but that's going to help everything else: diabetes, high blood pressure, everything. So I really dive into all that with patients, because it's important. Because if I don't do that, they don't get better.
right. What an incredible holistic mindset. So, just reflecting back, we're looking at many lifestyle pillars, right? What is your community? What are your sources of connection? How do you like multitask in the morning to help with bowel movements and constipation? Do you create rhythmicity in your life? How do you let tears out? How do you feel your feelings? What are you eating? Is there enough fiber? What's happening? Are you just sitting and, unable to get up? Do you need some mental health support? What's happening that you might feel frozen or, unable to do the things because of, all types of trauma affect the pelvic floor, right? Not just stress, but there could be different types of sexual violence that someone may need. And certainly having a sympathetic, empathetic presence. I'm sure you've heard many stories that were heartbreaking, honestly. And in some circumstances, the first time someone has ever told anyone the gravity of something that's happened to them. And the only way they could do that is if they felt safe, co-regulatory process that you create for them, all those touch tones, the neuroception, the voice, the presence, the eye contact, the smile, the gentleness, they feel a sense of relaxation. And I imagine that's happened for you many, many, many times.
Yeah, it's so important. I mean, you touch about things that is not taught in medical school, but that's so important. It's so important. It's not taught, but like you gotta be close to the patient. I mean, not encroaching to their personal space. That we gotta be close. We gotta look at them in the eyes. I mean, that is a window to the soul, yes, but people feel safe when you look at them in the eyes. They feel calm. They mirror whatever you're feeling. So you're gonna be calm. You want to be below their eye level. Not above them. Definitely sitting down, not standing. That's very, people don't feel safe when you're standing over them. So you want to be sitting. And if you can, be sitting a little bit lower on the stool than their eye level. That makes them feel comfortable and safe. So these little things that are not taught, but they're important. That's going to make people feel safe, because yeah, some of, like you said, many times I do an exam, and when you're examining a pelvic floor where there's been trauma, it actually brings up like the memory, and then people, really start crying either from pain or from the honest PTSD from it. And there has to be a safe space to disclose some of these things, which, like you said, have maybe never been disclosed to anybody else. So it's a privilege that somebody can trust me to do that, and to tell me that. But you have to create a space where you're looking at them, you're with them, you're not rushing, you're asking if they're okay, if they're comfortable through the exam. Again, you're not just trying to get through people and hurrying up, but like giving them that space, comfort level that you're there for them. It's really important.
I'm sure we're going to have a few listeners that are like, I'll travel to California to work with you. Just out of curiosity, we normally might do this more towards the end, but are you taking new clients? What's your type of practice right now? Are you in private
Yeah.
practice? Are you employed?
I'm employed now, but I am transitioning. So this is interesting because I'm transitioning. I'm leaving sort of the employed model and just really doing more of a direct specialty care where, we don't have insurance as a middleman. I definitely just take care of you more transparently. You know what you're paying for. We have the time. We have like an hour to spend, which is unheard of, with a patient one-on-one to go through all these things that are so important. Again, what are you doing for your diet? What are you doing for connection? What do you do? What is your purpose? The spiritual questions. But these are really important. What is important to you? Is it church? Is it your activities that you do? Bingo. What's important to you? And what can we do for preventative things? Because many people ask me, okay, what else can I do to improve my prostate health or improve this or prevent that? So really going through all that in more detail takes time, and that's really what I like. I like to spend time with people. I like to dive deep into things that are important to people, that is not medically related, to say, but it is so important and crucial to really be able to take care of them, because sometimes we label people non-compliant and we put all these labels, and it's not about being non-compliant. It's because we don't understand what their goals are or what their fears are. And when we ask that and address that, then it's so much easier for everybody. We really can take care of them when we understand, what are they scared of, what are their concerns, what are their hesitations. People do things or don't do things for a reason. So when we get curious and we ask, that's the easy answer. But we don't ask because we're so rushed, and we put labels on people that are really not necessary.
Yeah, it's so true. For those who've been listening, the direct care model is amazing. You really get a transparent payment. You know exactly what's going to be involved in that clinical visit. Your visits are scheduled, the clinician's on time. You get extra, attention, and the follow-up really suits the more problem or root cause, sort of going deeper in as opposed to just offering perhaps a surgical or pharmaceutical intervention, which may be appropriate and necessary. Maybe there's other steps to take first to, like, as you were alluding to, if there's severe constipation that's creating the basis for a problem, but that constipation is never really explored, it seems a little nonsensical to try to solve the problem without solving that problem. But we see that all the time, unfortunately, like all the time. And as a primary care doctor, my job was always to try to like toe the line and say, okay, great, we got the opinions and we know what the surgical or pharmaceutical thresholds need to be, but can we pull it in a little and think about other things we might do in the interim that could bring some relief or even go deeper into solution oriented. So I love that you're headed in that direction, and hopefully there might even be some interest from our conversation to the Southwest and Southern California regions. I'd love to switch gears a little bit, and I'm really interested in, and you've shared with me prior to our conversation that you would be open to discussing this a little bit, this topic of burnout. And, it's such an interesting term, right? There's these 3 clinical definitions of it, but I'd like to hear how you knew you were in burnout and kind of what your path out was, because you're such a problem solving oriented person. I'm sure you had to understand what was happening before you could identify the solutions. And I think this is something also people don't realize is that, wait, this is burnout? I thought I was just perimenopausal, or I thought I was just going through a separation or a divorce, or I thought I was just in an argument with my partner in my practice. But beneath that is often something a bit more complex.
Yeah, so I mean, burnout is really, I mean, there's many definitions, but it's chronic unmanaged stress. And then we sometimes can't identify it at all or for ourselves. It's a great point. Many times, a partner or a friend, somebody's going to tell us that something's off, that something's wrong. And it definitely was for me. Like, my husband told me, like, you're kind of like Debbie Downer, like, you're acting very negative, like somebody that you say you don't like to be like, and you're just like that now. So everything is negative, you're cynical. I mean, these are like the signs, symptoms that you become cynical, you become negative, you're angry and reactive all the time. If you're a physician, you're going to be depersonalizing the patient. They're just like a number or a disease or a diagnosis. It starts spiraling to anxiety, depression, and obviously the worst part of all of this is, suicidality. And we know that more than 400 to 500 per year of our colleagues, die by suicide every year. So this is really, really a tragedy. This is definitely, something that should never be tolerated, and that people hopefully can start, understanding that one, there's a way out always. There's always a solution. There's always hope, and that you can get through it. You can get out of it, but something has to change. You can't keep doing the same thing and expect, things to change. Like something has to change. So we have to identify, what is causing us stress. What can you control? What you can't control? And a lot of things you cannot control, but you can control how you react to it. What is, your outlook on the situation? And a lot of it really can be about, what are you putting your attention to, your intention? What are you consuming? Both reading on social media, talking to people around you. Like, what is your environment that you're consuming? What are your daily, let's say, rituals or activities to stop the stress cycle, to stop the cortisol from being released in this sympathetic nervous system overdrive? Like, what are you doing daily to get out of sympathetic and really start in a parasympathetic sort of place? So, if you don't have a routine to do this daily, then it's going to be very hard to not be swimming in burnout, because it's always, things come so quickly in our modern day and age, and we get consumed by this news and that news, and this is happening. And pretty soon we start, taking it all in, especially if you're an empath. You start consuming and feeling everybody's feelings, thinking they're yours, and they're really not. So when you start putting attention to different things that are going to be healing or uplifting or nourishing, that's going to help you get out of that fight or flight. When you have a routine, whether you call it journaling or meditation or prayer or like your quiet time, that's your
Mm,
healing, and it has to be scheduled. It really has to be scheduled, and it has to be non-negotiable. And it don't
mhm.
have to be 2 hours, but it could be whatever time frame you set every day, 15 minutes, 30 minutes, an hour would be great. But whatever time frame you can do to start your day kind of a little slower, more with a parasympathetic tone, instead of like the fight or flight. How many emails have I not responded to? What do I have to do? Like, that's not the way to start your day. And how do you end it too? Do you end it in the same, oh my gosh, what is there to do tomorrow? Or can you end it with gratitude? Can you start it with gratitude? Stress and gratitude cannot coexist. So it's either one or the other. It's like oil and water. So which one? And when you're in gratitude, when you're in love state, you're releasing, all that serotonin and all the dopamine, all these happy hormones. You're gonna feel different. Your cells are gonna feel different. Your body's gonna be healing state, not in a, immunosuppressed state, when you're in stress state. So understanding our thoughts, are affecting our body to the cell level, is going to start making you think like, what can I do to get out of it? What are my daily routines?
Yeah, it's incredible. My background included several years of study with Dr. Vasant Lad, who's an Ayurvedic teacher. And for those that might not be familiar, Ayurveda is the traditional healing system of India. And the foundation of any treatment plan in Ayurveda is something called a dinacharya. And it includes your wake up routine and your wind down routine. Like fundamentally, what they understood, and Ayurveda developed over millennia of observation of the human condition. And so I always say it's the most advanced case study that there ever was. But this notion of what is the wind in routine and what is the wind down, And right now, I think a lot of humanity, especially as clinicians, we see this. Why are we all in this unmanaged stress state? And a lot of it has to do, like you said, of sort of thinking we can just let a horse gallop on the beach endlessly, looping itself. This is my favorite analogy for people. It's like stress is a stallion on the beaches of northern Morocco in those beautiful videos you see, and he's just galloping, and you're holding on for dear life. And this, how do we help that galloping horse, this unmanaged stress, rein itself in? And I think you beautifully outlined that it has to start with a certain practice or a certain philosophy of how you start the day. And that doesn't mean you wake up and you're like, what's my email that I need to answer right now? We're all guilty of it, each in our own way. But there has to be a consistent decision with the way technology encroaches on our lives now to have boundaries with it. Because I think, especially for clinicians, the type A nature that we're hardwired with has a quality of compare, compete, and we just can't help it. It takes a lot of unlearning to be like uncompetitive, because that was the very features that have allowed many of the hurdles professionally and educationally. And so I'm curious, do you have a particular morning routine or evening routine you could share that
Yeah.
really nourishes you?
Yeah, so I mean, I used to do this is burnout. This is how you get burnout. So if you want to know how to get burnout, do this. So I mean, I
Yeah.
go on the phone and just read the news feed from Facebook and all the news, and then all this terrible news. And of course, after you read that, you're like, oh God, the world's ending and everybody's terrible, and like the humanity's going to hell. I mean, of course, because that's what it does. It gives you fear, it gives you separation. Like they're against us, and what's happening, and they're terrible. So I do not recommend that. Don't do that. So, I mean, my routine really is, I usually try to wake up like 6:20 or so, and by 6:30, I try to just go to my other room, and I do pranic healing, which is again, it's what they do is Arhatic yoga. So it's a system of meditation and breathing and exercises that you know you use also with pranic healing, but that's a little different. One is like a service, and the one's just for you to really get energy, get your parasympathetic nervous system. So really, I start with what we call super brain yoga. So it's just you do exercises to basically move the energy from your lower energy centers to the higher energy centers, which just help your cognition. So it starts with that. Then I do breathing exercises to calm your nervous system, and then I'll do about between 20 to 40 minutes of meditation, and then I do some exercises to move the energy afterwards. So just kind of like you know nothing fancy, you're just moving your body. So you're just moving again whatever energy you generate to move it all and circulate it and kind of like stay in your body. So that's what I do daily as a practice for that. I also try to incorporate some type of other physical exercise 2 3 times a week as much as it can. So there is biking or the asanas, like yoga, but whatever you like. You don't have to do yoga. You can do anything you like. But just to move my body, move the stress. I also try to, every night do a gratitude practice as well, and just practice this throughout the day. Like what am I grateful for? Tell people I appreciate them, and just focus on like, well, okay, this is crazy, but what can I be grateful for in the moment? To really calm down your nervous system, and again, get out of fight or flight, and just be in more happy place. So that sort of practice. And then I do try to make myself best, just like I tell my patients. I mean, I do them as well, because sometimes I just pick up a lot of people's energy and their stress energy, and I really want to get rid of it. And so it really helps me to calm down, to relax, and just to feel like lighter. And if you do it at night also, it helps you sleep better because it lowers your body temperature, and that's what helps you go to sleep when your body temperature lowers. So it's a great way to help you sleep as well. So if you do it in the evening, that's helpful for sleep routine. You can do it anytime, but it can be very helpful at night. So I try to do that, and it just helps me. Just helps me to have a routine where again I wake up and I'm moving my body, I'm breathing to again bring that cortisol down and just being parasympathetic, and just have time to be quiet. People call prayer when you talk to God, but then you got to listen to God. So when are you listening? It has to be in a time that is quiet. So
Mm.
that's when if you believe in God or higher source or universal light, whatever you call it, that just be a time that you can listen to those messages that you're hoping to get your prayers answered to. So we all have that innate. of course, healing, but also innate wisdom. But we have to listen to it. And if we're so bombarded with all this noise, we can't listen to our own wisdom. We are swayed by this, swayed by this person, their opinion. You need a time to really be centered and listen to yourself.
Yeah, it's really something to imagine what it would look like for medicine if the process of a wind in and wind down routine was as essential as any pharmaceutical we might give. And I love that you embody what you recommend. And I think that there's something sort of disingenuous when clinicians are so overwhelmed that, it's no fault of their own in some sense, the way systems are structured, that they don't have the time for that self-care piece for themselves. They're charting late. They're dealing with their own ambitions on top of everything, papers, conferences, and different things that kind of come into the mix. There's aging parents and or teenagers. There's partnerships. All those things need tending to. And so often carving out the space, and people will often say to me, "Oh, I don't have time for this kind of practice." And I say, well, you might find, and I'd love for you to comment on this, you might find that if you did do this practice, your life would be a little bit more intuitively guided, a little more efficient, a little easier to let go of what's not serving, so that time, your relationship to time and stress would shift. Would you say you find that to be the case?
I mean, I have a big thoughts about that because I think this I don't have time scarcity mindset is what it is. You're in this scarcity of there's not enough time, not enough this, not enough everything. And the reality is there's plenty of time. I mean, the busiest person, we all have the same 24 hours and like they'll make time for things that are important. Like this is really important. It's just shifting our mindset that this is critical for your wellness and you'll be more efficient if you're in a calm state than if you're in a frazzled state. You can't think, compute, organize when you're in fight or flight. And so the whole prefrontal cortex part of your brain is like, shut up. It just is. So when you're in calm, rest, digest, you actually can be more creative, more organized, really prepare things a lot easier to then do all the other things you want to do. But if you have this mindset that there's not enough, then it translates into everything else in life. And there is plenty of time. And yes, when you start practicing that every day, you will notice your efficiency and your calmness and your ability to have a little bit more space. When the situations or chaos happens, it's a lot bigger than when you're not having a practice like that. And I also think it's so important that like it just has to be scheduled. It really does, and to have boundaries. We kind of alluded to a little bit earlier. Is critical because when we say yes to everything, we're not gonna have time to say, yes to ourselves because we say yes to everything else. So we gotta know what we want, what are our goals, what are our beliefs, what is important to us. So then when opportunities come our way, we can say, no, thank you. That's not something I want to do and being okay saying no, just saying that's not something I want to do, thank you very much, or maybe this person is better suited for this opportunity, and not do everything that you're asked to do, because if it's not a hell yes, you shouldn't be doing it. And so you have to think about it, be in tune to yourself, what's important, what are things you want to do, and have those boundaries to say no so you're not overwhelmed, and then just have that space to be able to say no, and then also not to be so frazzled. And a great
Mhm.
thing when you're asked to do something that you're not sure, just say, just maybe give me like 24 hours, or like I'll let you know in 15 minutes even. I mean, give yourself that space of time. You don't have to say yes or no to everything right away. To then think about like, is this something I really want to do? And if
Mm.
it's not, then don't do it.
Yeah, so true. And, it's interesting. I was just talking to my husband about this morning, and I said yes to something recently. It's very small. I'm not going to go into detail. And I regretted it. And I actually had some resentment to the person I'd said yes to. And I realized it wasn't really their fault, of course. Like I could feel the resentment rising. And this is what meditative practices give us, right? We develop more awareness so that we're not unconsciously resenting someone. I was very consciously resenting them for the thing I had said yes to. And what I sat with it a little bit more, and I said to my husband, I didn't feel resourced enough in the moment to know how to say no.
Hmm.
And I think what you say in that is so valuable. And this incident reminded me that it can be so important to have a couple ways you say no to people, and to not feel guilty or shameful when you do say no, because sometimes that no is a yes to you, right? You're saying no to one thing, but you're saying yes to something else inevitably. And I was sort of surprised when I really recognized that when the question came, I was in a hamster wheel. I was cleaning, cooking, I was doing a bunch of things all at the same time, companies in town, and here comes this question. And I was just like, oh, I don't have the bandwidth to sit with this question. I'm just going to say yes, because that's the default is yes, how can I support you? Or yes, what do you need? And then this has been through my own coaching and my own healing journey. And I realized it's now been about a week since I said yes. So we're in real time here. And I realized like I did not want to say yes to that. My actual answer was no. But in that moment, I just didn't have enough languaging in the midst of my busyness. And it's just an ongoing skill. I think we're always in that curious state of self-discovery. But the key to all of what you're talking about, I think, in terms of this burnout piece, is really knowing how to say no. And, as clinicians, boy, that is certainly not part of our training. And especially for those of us who came up in the 90s, right? Before work hour restrictions, before there was more sense of boundaries. It was really house of God kind of medicine where you were all in. If somebody was sick on leave, if a patient needed it and you were post call, it just did not matter. You had to say yes. There was never an option to say no. And so I still have a lot of unlearning to do in that. And I myself also have walked through that burnout process. So I really relate to how powerful it is to manage stress, but sometimes to have the time to manage stress, we have to be saying no to things. And boy, I really appreciate how those boundaries become a little bit ambiguous when we're feeling under resourced. And so I really want to highlight that because it's been so prominent for me this week.
Yeah, and the thing is, like, even when we have a practice, whatever mindfulness practice, what do we do? I mean, unless we like reach enlightenment, like we're always a work in progress. Like we're always gonna have times where we didn't say what we wanted, and it's okay. And then we really have to work on like self compassion and not being like, oh, how can you do this? You're terrible. Like it's just okay. Yeah, well, I said something I didn't want to. Now I realize it. I feel like that was not right. Then what can you do from here? Like, what is the next step? Compassionate for yourself or for the other person, of what you want to do next. So you don't sit on that resentment now that you realize this is not what you want to do, but what can you do next? Again, but being always self-compassionate, like, okay, like, no matter what practice we have, no matter how much, meditation, spirituality, whatever you have, like, we're always going to be one tested. We're going to be learning. We're going to be falling, climbing. It's just a spiral, loopy way of life, and that's okay. So every day we just, have to wake up and be like, okay, like another lesson, and what can I learn from this? Be compassionate, and I tried the best I could, but at that moment, think life was life, and it's okay, but just keep moving and keep learning, every day with every situation, the good, the bad, and the ugly.
That self-compassion piece, right? That's the most powerful gift, I think, especially if we have a really critical mind. So we're going to start wrapping up. Your time is so precious, and I'm so grateful that you have taken this time out. And it's been so wonderful to get to know you a bit better. And I wonder if there was anything we hadn't touched on as we're starting to wrap up that you wanted to talk about or share with our audience today.
I think it's so important what you mentioned as well, and you sort of said that you are, but like to have that curiosity. I think if you probably learn anything from this podcast, I hope you really tune in to all these episodes because I think a big theme is this curiosity, this wanting to learn, this wondering and wanting to learn things that like stay curious and open and realize. we all, are going to change, even if you pick something that you like, maybe it's good for a certain time and then later it's going to shift to something different and that's okay. But always be willing to learn, to read, to listen to something uplifting, different, expand your sort of breath and width a little bit, get a little uncomfortable, and that's okay. That's actually a sign that you're healing because you're curious. When we're always, oh, I don't like this and negative and this is terrible, I mean, then that may be a sign that you really are in burnout, that you're in chronic stress, that you're not in a good place, when you can't just be open minded about things and willing to learn and understand different things. So be curious. You never know what could be beneficial for you, for a patient, for a loved one. And I mean, I think that's so fun to always learn new things, to always like think, oh, I didn't think about that, or you have your whole belief system, and then something else comes out, and you're like, whoa, well, that's totally different. That was not really great. Like this is so much better. But if you don't try, if you don't dip your toes, the worst that can happen is it's not for you, and that's okay. Like you tried it, it was not great. You do something different, So just try things out. I think it's so important to have that like 3-year-old mind. When you're curious about anything, you ask why. I mean, that is a beautiful mind with like little kids ask. Don't lose that.
Mm.
Stay curious, stay asking questions. We that gets sort of beat out of us, through childhood, of course, but through medicine as well. Don't ask why, just do as you're told. And that really can affect a lot of people when their creativity in their mind sort of gets a little bit dampened. So, you know, fight through that. Just be you. Especially no matter where you're in your training. So many people are gonna want you to conform, to be sort of part of the mold, but like just be you. That the beautiful thing about each of us is like we're our unique selves. We bring those qualities, those gifts, that accent, that whatever you have that is you, that is what's beautiful about you. So just be you and don't be like anybody else. Like you don't have to. Just be you.
That's so beautiful. What a what a beautiful thing to just embrace, right? The uniqueness and in such a compassionate way with such understanding that it's confusing to be in a human body. It's confusing all the sensory pieces, all the societal influences, and that through that lens of curiosity, we're always going to be inviting ourselves into perhaps a space where there's more compassion, more contentment, less stress. But that has to be very intentional because today's world would walk us the opposite direction. I'm curious if you could, this is our sort of themed podcast wind down question. If there was a sort of something that could be introduced into medical curricula or training that you think, and I think we've touched on a lot of them, but is there any particular one that you think, boy, this would just be so important if this was a part of medical training or office visits that was never taught to me?
I think it's about training and just how we take care of it. It's just, I mean, love. I mean, I think when we like move to a place of love, and it's not just love for patients, because I think we always say, oh yeah, we love patients, but it really isn't. It's a love for our colleagues, a love for the system, a love for the healers, the trainers, the nurses. I mean, I think a lot of that is missing. I mean, I think we've sort of led a lot with a little more masculine energy and more like get things done, and you got to just be there until you're the last one standing. That's okay, but I don't think it's been so great because otherwise we would be in a different place. I think when we start doing our training, our surgical skills, our conferences, with a lens of not like Eminem, you're the terrible person. How can you do this? To a more like, let's learn this, be compassionate, let's be curious. What can we do like this? And really have that theme of our training and our delivery of care. I think that would be, a really great place when we
Mm,
switch over more to a love and frequency with everything we do. And I think that's what we're supposed to be. Like that's what I thought we are supposed to be. These healers is lovers of other human beings and souls we're taking care of. And
mm,
I don't think that's truly always the case. And I think it could need a little bit more of that. I think it's changing. I think that's wonderful. But we really have to be a conscious effort to do that. And it starts with us. I think a lot of people say, oh, the system, but we are the system. We are part of the system. How we're leading every day, how we're treating our staff, how we're treating the front desk, how we're treating patients, how we're treating our colleagues, how we talk to each other. That is, where the change starts, and then it trickles down. So we're all part of the system. And so I think we've got to really infuse that with love a lot more.
Yeah, that sort of spirituality through the whole lifespan, right? Just embracing that. And I think love is a central theme in that. And that's such a beautiful way for us to wrap up. I couldn't add anything to that. What a beautiful, beautiful reflection. Where can people find out about your practice? Do you want to give us a little teaser about that? Or how can people find, and if you had any other places of information you wanted to share with the audience where they could find you?
Yeah, they can go to my website is dianalondoñomd.com, and you can reach out there or on social media. I'm usually on LinkedIn. If you are on there, I tend to live there, so check it out there as well. But yeah, if any of this resonates, is important, somebody looking for a great urologist that encompasses whole person care, I definitely would love to take care of people again in a different way, where we really spend a lot of time with each other to get to know each other, to trust each other, but you really get to prevention and healing, true healing. So yeah, look me up on the website or LinkedIn. I'm always there.
What a fabulous conversation. And I'm just delighted to wrap up our time with you. And thank you so much for being here.
Thank you so much for everything you do. Thank you.